3 years ago, the world went through an unprecedented situation. Flights were grounded, borders were closed, everyone stopped traveling. There were huge economic disruptions. And to this day, one of the unanswered questions we have is how effective were these closures at actually controlling the COVID-19 pandemic? In this study, we evaluate whether national border closures were effective in controlling the COVID-19 pandemic in the first pandemic wave. We used a couple methods to evaluate real-world data from 166 countries around the world. On a global level, we found that total border closures that were implemented by countries around the world, including 95% of the world's population in mid-March 2020, did succeed in slowing down the global pandemic. Targeted border closures that were implemented by the majority of countries in early February 2020 did not. Within countries, it was a huge variation in whether or not these closures were effective at slowing down epidemics within countries. Total border closures were more effective than targeted closures, and the factors that were associated with more effective closures included putting these in place early in the pandemic, and for targeted closures, targeting a large number of countries, and so much so that they resemble total border closures. What does this mean for policymakers? They should really only consider border closures as a measure of last resort, and when alternatives such as mandatory quarantine of international travelers isn't an option. They should also take advantage of the little time that this measure might buy them to improve domestic public health response. And finally, they should cooperate with other countries in making these decisions and also be informed by guidance by groups such as the World Health Organization.